been a pivotal piece of my career to be involved in the union over the past decade and a half. It brings together such a diverse range of people. And when I was early in my career, it was really a moment for me to be able to learn from the experts, but then also to have my own exposure to TB and to lung health.
We want to be the conference for lung health and the conference for TB, but we also want to make sure that we have a balance where we can, on the one side, have basic scientists through to implementers and implementation scientists, policymakers, which are able to meet at this conference, which is very unique, which a lot of other conferences don't have.
We need to invest more on those point of care and diagnostic tools which are actually easier to implement at the local levels, because everything which is done for communities.
Everybody who gets TB gets it because they were infected by somebody else, another human being who has TB. So we have to stop that from happening, which means finding and treating everybody who has TB so that they're no longer infectious to other people. There needs to be a commitment to doing things differently. Doing things the same is not an option, because doing things the same is not eliminating TB.
We have to do active case finding to find the people who they themselves have TB, but they don't know their status, and try to bring the modern and the WHO certified diagnostic tool down to community, where they can access TB testing, TB diagnosis, and then support them enroll into the government health center nearby where they are living.
For one of the TB vaccine trial, which is M72 trial, what we see is the need is there and people are waiting. So the thing is that let's bring the evidence on the plate, and then together with the TB program again, already start to think how to implement it. Not waiting for evidence and then start to think what we're gonna do, but still now, while the trial is still ongoing, we already think about how to prepare to be implemented if the result is promising.
We have the ultra-portable X-rays, we have the AI chatbots with the patients, we have the One Impact platform that you can interact with, that you can use to disseminate information, and young advocates are everything we need for getting our message through.
I believe that policies should come from bottom up, and when you engage the majority of your population, you get good feedback. I believe that the parliamentarian has a lot to do when it comes to increase in funding allocation, especially to places where the people are unserved in rural areas, and especially for screening and youth advocacy, it's very important.
Our courses focus on the programmatic implementation. There are many clinical courses out there and courses for academics run by universities, but our added value is the fact that our experts, they work with national key programs in the implementation, and they see what the challenges are.
TB, it's known as a disease of poverty, so it is very much a disease which, it's not only a clinical problem. There are so many social determinants of health you rightly mentioned. There's gender, there's socioeconomic status, there is geographical barriers, which all affect TB and how patients access care, how patients whether they complete their treatment or not. So it's not only about having the medicines or the diagnostics in place. I mean, that is very critical, but we also need to look at the social determinants aspect.
For tobacco control, I must say just 3 indicators. If we just integrate these 3 indicators, number 1 is how many people counseled. Number 2, how many people attempted to quit. And number 3 is how many people actually quit. So if we just integrate these 3 indicators in the whole list of indicators of tuberculosis, we can achieve wonders.
Making the conference the best conference we can, making sure the best science is being presented, that people are having an opportunity to consolidate collaborations, meet new collaborators, and really the idea is we're hoping that the conference brings us a step closer to achieving the Union's vision and mission of ending TB suffering and bringing in a world free of TB and lung disease.
And stigma to end TB.
Union Conference!